So good morning. We're here today to train on the Eclipse micropen procedure. This is Ginger, our model with the very beautiful skin already, and April, our trainee. Ginger has completed her medical history, filled out the informed consent and executed it, and read the pre and post care instructions and removed her makeup, but we're still going to disinfect her skin with some alcohol just to make sure that as we do our percutaneous collagen induction therapy, we are doing it across a relatively disinfected surface. We treat every square millimeter of the anatomical area, so I want to make certain that it's all nice and disinfected. Thank you. Sure. And with the Eclipse micropen, each patient has their personal bottle of hyaluronic peptide serum and a sterile needle. We turn the device down to below 0, all as low as it will go. Put the slot or the tab in the slot. We're good to go. We adjust it to the depth. We're going to be treating, since she doesn't have any heavy acne scarring on her cheeks or medial cheek lines to speak of, and just some mild dyschromia, I'm going to start out treating her at about a ½ millimeter of depth. Our standard protocol for general facial rejuvenation is we will cross-hatch her. We'll make a pass top to bottom, lateral to medial. We'll move it about 1 inch a second, and we will use the microglide to hydroplane across and allow us to easily move even though we are penetrating into her skin. I'll put a little on. How you doing? Is that relatively tolerable? Mm-hmm. You can see that she presents with some mild erythema or pinkness. It's a good thing. It's a very quick treatment. It's very efficacious for a multitude of skin conditions. And we're basically halfway done with this part of her face. She has some periauricular wrinkles here, so I will slow down in this area and maybe give a little additional microchannels, create some additional microchannels. The way that we're aggressive with the micropen is not by going deeper into tissue, but by making additional punctures through the skin and creating more microchannels in areas of trouble. As I mentioned earlier, his skin is very nice. I'm not pushing down on the device at all. I am merely hydroplaning across that microglide peptide. Now she has a little medial cheek line she's trying to form there, so I want to give her a little extra on that. Still comfy? Mm-hmm. I'm going to go just a little deeper on that righted. Let me know if this becomes uncomfortable. Mm-hmm. A little extra lube. I retract the skin and work away from my retraction. You still okay? Mm-hmm. Okay, I'm going to go back to my original depth. Notice that once this hand has touched the patient, it never touches the device again for sterility purposes or aseptic technique purposes. I'm going to work really close in on your wannabe crow's feet here. Let me know if it's uncomfortable, and I can always work at a shallower depth. This is not about being brave. Very good. Okay, now, open your eye and look up at me. I can get, the nice thing about the micropen is it allows us to get in very close under the upper eye, and by having her open her eye and look up at me, it gives me great exposure. You're good. How you doing? So one of the things you need to note for me, please, is the pressure which I'm putting on it, because when April treats the other side of your face, you have to let her know if she's pushing harder or not pushing as hard. You also had mentioned earlier some perioral wrinkles here on your upper lip, so we want to make sure we treat those. Now, do like you would if you were blotting your lipstick. There you go. That gives me better exposure to the wrinkles. The upper lip can be a very tender area. There's some big nerves. Good job. Well done. Okay, relax. We'll get the marionette now. Work our way across the chin. If she had heavy acne scarring or an individual acne scar or two, we would do a more aggressive technique on it, but she does not, so she's lucky in that regard. I'm stopping at the midline for you. Now the nose can be a little more difficult too. If you'll notice, I'm doing about 2-inch pass throws this way and then 2-inch throws this way. She also mentioned this redness on her cheek, and while this will initially make her a little more pink, we have seen very nice outcomes on these very superficial broken vessels or telangiectasia. Again, I'm retracting downward, so I work away from my traction. You comfy? Mm-hmm. Many people get very oily right here in the crease of the nose. I always like to give a little extra attention to the nasolabial fold. This circular technique merely allows me to make extra microchannels into the areas where I feel the patient could use it. The nose is very sensitive as well, and a lot of people laugh or sneeze when you treat the nose. It's really good for large pores on the nose. Ginger doesn't have them, but we're going to treat them for training purposes as though she did. The little bunny lines. You all right? Want to sneeze or laugh? Okay. It's also very sensitive, is it not, Ginger?
It's more sensitive.
So basically, with the exception of her forehead, we have completed this treatment on the side of her face, and she mentioned prior to that she had a little brown spot here she wanted us to treat. I want to get that, but she felt pretty comfortable with her overall forehead look, so we won't be treating the forehead today. The round spot, the little round spot here. Basically just sun damage. They're on this side of her face, probably from the UV from driving, because they are not present on the other side of her face. Voila. A little pinpoint bleeding right there, but it was right on the bone. We're not concerned about that. Many times we see pinpoint bleeding across the anatomical area. It's not an indication of a good treatment or too aggressive a treatment. It's just a characteristic of each individual skin. How about you, April? You ready to go?
Sure. What was the...
I treated at 1/2 millimeter on her cheeks.
Mm-hmm.
I went to 0.75 millimeter on the red areas and the nasolabial fold.
Mm-hmm.
I was at 1/2 millimeter here and 1/2 millimeter under there, 0.25 on the nose.
All right.
We have a treatment chart, so you can easily.
Okay. Right. And you already have the alcohol. You've already cleaned it.
Yes, ma'am. She's disinfected.
Okay. So if I can get you to just turn that way a little bit, perfect.
Oh, yeah, there you go.
Okay.
And start on a fleshy area. An inch a second. And does that feel about the same amount of pressure that I was applying when I did it, Ginger?
Mm-hmm.
Overlap about 10%.
And then you kind of went in here, right?
And I also like to, it's nice to treat in the trough of the righted.
All right.
Slow down a little. And working against the traction on her face is not that critical because her skin is very taut. And even those of us with good skin can benefit from percutaneous collagen induction therapy. It's a very good technique. If you feel it start to drag a little bit or get sticky, you probably need a little more of the peptide.
Right, so...
That area is done.
All right, and so... up here on the cheek. All right, we're still at a 1/2. Is that what you use?
Very good to check one's depth as one moves from anatomical area to anatomical area. Slow down a little. Never apologize on camera. And let me
Does that
just
feel-
get you a little more lubage.
Thank you.
It won't squirt upside down.
I just got squirted right there. Can you?
And as you go across the surface, you want to remain perpendicular to the skin so you have a reproducible, predictable depth.
So does it? Am I?
You're doing awesome. You sure you've never done this before?
Nope.
How you doing, Ginger?
Fine.
Okay.
Okay. Can you get a little bit more up there for me?
You betcha.
All right. So I'm sorry.
It's hyaluronic. Your body makes it. Sorry. Couldn't see from my own hand.
Here, let me.
Perfect.
The cotton's yummy too. Is that okay? All right. So I'm going to come up on the lip on the top.
Mm-hmm.
There. Thank you.
Thank you. She remembers.
It's
0.5? We're good?
It's 0.5.
Yeah.
Okay. Is this too much more sensitive?
Right at the vermilion border, it can be a little it can be a little dicey without a topical anesthetic. Very nice. Need some HA on the nose.
Okay.
I try to never go directly down the bridge of the nose. Very difficult not to bruise. So I just work up to the, maybe circularly up to the midline from both directions. Direction and technique are not nearly as critical as making certain that we create hundreds of thousands of microchannels into the dermis.
I'm going to come under the eye.
Now, a nice technique is, rather than just come straight at their eye with the pulsating device, is to start over here and work your way in.
Right.
And we need to work this lateral canthus anyway.
All right. So if you look out. Thank you.
And you can get closer to the corner of her eye. It's scary, but we do it every day. And the reason we have her open her eye and look up is because it gives us such better exposure to that lower lid where that crinkly peri-orbital wrinkles start. Very nice, April. Very nice. And you can get in closer yet to those lower lashes. And it's hard in a small area to get the crosshatch, so making the little circular motions will give us the same number, theoretically, of punctures into the dermis. And creating the microchannels into the dermis is what stimulates the collagen.
Good, good. All right.
Let's go to 0.75 and get this red area, which she does have bilateral, but even though she doesn't have the brown spots.
Okay.
There we go. You stay perpendicular across the plane very well. And now the chin, we're out of here. And then we get the good part, the extase mask.
Oh.
Mm-hmm.
Okay. This way. Can I have a little bit more right there?
Careful. I like to spread that marionette like this, and that gives us good exposure right in there.
Okay.
Very nice. And there's that little medial cheek line that was present on the other side. Gets a little extra attention. How you doing?
Doing fine.
So now we use our extase mask, which is hyaluronic acid, vitamin E, vitamin C, most of our practices prefer to keep it in the refrigerator because it feels really nice and cool going on. So it was
what's
more
in this
comfortable
mask?
for fillers, what you just said?
No, this was a lot more comfortable. I've had one filler done.
And do they
in my
use
shoe.
ice to numb you when they did that, or they put a numbing
She
cream
did a
on? Or?
numbing. Yeah, she did a numbing. But it's
And
well,
many, I'm a big fan of using the numbing
still
cream to
feel-
this. There's absolutely no reason for the patient to be uncomfortable.
So,
It was not uncomfortable though.
what's in this mask?
Hyaluronic acid, vitamin E, vitamin C, vitamin B3, B5,
So we open it up?
amino acids, yes ma'am, and there is no right side or wrong side. And we will leave this on the patient for 15 to 20 minutes, unless they're in a big hurry to get back to work, because obviously she could easily put her makeup right back on and go back to work and no one would know anything happened. While her fibroblasts have been stimulated to produce a tremendous amount of collagen and elastin.
How does that feel?
It feels good. It's cold. So does this just soothe the skin?
This is just to calm you down. And to further hydrate your skin now that we've opened up these hundreds of thousands of microchannels into your dermis. The hyaluronic, it doesn't have to fight its way through your stratum corneum and your epidermis because we've opened up a clear path for it.